Well, hello there, Dr. Brian McKay, Core Health in Darien. My podcast, Not Just a Chiropractor, Stanford, Darien, Norwalk, and New Canaan. All right, today we are going to discuss the aging brain. Now, I happen to turn 61 this year, so I don't know if you're concerned about your brain. I certainly am. And what I'm doing is studying a lot about the brain so that there are ways that we can basically, you can't not have dementia if you're predisposed to it, or there's a genetic thing I'll go into in a little bit. But a lot of today's problems come about because the standard American diet and lifestyle. We don't exercise enough, we don't eat right, we don't get enough rest, we have too much stress, yada, yada, yada. Okay? So this is not going to be a lecture on the diet, stress, not exercising, and the yada, yada, yada. What it's going to be is it's like a simple way for you to know if you are at risk, at greater risk for having dementia and number one, Alzheimer's. Yep, that big scary one. And if you're 60 years old or maybe your late 50s, you might notice you get a little foggy in the brain. Well, what do you plan on doing about it? That is really the question. What what do you plan on doing about it? Well, you can really start to address things we just talked about. That's not the purpose of today's podcast. So, what I want to tell you is like, it's important that you take these steps now. It's like, how often do you hear about somebody who's a cigarette smoker and they get diagnosed with lung cancer, but all of a sudden they're going to start, they quit smoking. It's great that they quit smoking, but it's like a day late and a dollar short typically. And when you are getting older, listen, your brain is not going to function the same way it used to function. What you have in the brains, you have these things called glial cells, and glial cells kind of they do a lot of different functions. You have so many damn glial cells, like there's billions. So certain cells you have millions, you have billions of glial cells. And what happens is certain people are at a greater risk of having these glial cells screw up because of hyperlipidemia, which is too much fats, hypercholesterolemia, too much cholesterol. So you have your brain needs fat and it needs cholesterol. But the problem is when you have too much of it, well, there's a problem. And it's not just enough for you to take cholesterol lowering medication, because then you can still have hyperlipidemia as well. Remember, lipidemia, lipids, fats, hypercholesterolemia, cholesterol. So yeah, well, it's not a bad idea to be on a statin drug to kind of stave off that. But you got to remind yourself your brain needs it. In some cases, people bring on some of these problems because they don't have enough cholesterol. It gets too low. So there's a happy medium. You need some, you need enough, but not too much of everything in life, right? You need money, but not too much. Well, there's an argument to say for that. So what happens is these glial cells basically at night kind of take out the garbage out of the cells, and they allow for cellular transport of these goodies, the lipids and the cholesterol into the brain cells. So it's a process. And what happens is when the cells, think of a cell get too fat, brain cells and neurons, you can't get the garbage out at night. And that's a problem. Because think about carrying an extra 25 pounds around. It's a problem. If your brain's carrying around garbage, it's a problem. So, in order for you to determine whether or not you are at risk, okay, the simplest way that I know is 23andMe. Yes, simplest way to find out. Is it really, you do the saliva test, it comes back, it tells you if you have a certain marker called APOE4. APOE4. Now, I know that's a very, very long term, but here's what it is. It's a genetic marker, and MIT researchers found that if you have this particular marker, you're at a much greater risk for dementia and Alzheimer's. So what I suggest you do is go take the 23andMe. You don't have to go to your doctor for a special appointment. They typically I see 23andMe running specials around the holidays. Take the test and you look for the APOE4. This genetic marker will tell you if you're at risk for dementia and Alzheimer's. So it's a very simple way for you to gain insight. because it's also could be a wake up call. If you do have the marker, you know there's a greater risk for it. Well, maybe now's the time to stop smoking. Maybe now's the time to start exercising. Maybe it's time for you to pay better attention to your diet. Maybe it's time you do get on a statin drug. So basically, knowing that you're at risk is a way for you to be more concerned about brain health. We look at heart health, liver health. You know, it's easy to have liver health. Stop drinking, but it's a way for you to know if you are at risk, and then you can take the necessary steps. Because there's a certain point. There's many stages, like say in Alzheimer's. Stage one, two, three, and four, you can pretty much go backwards and start to limit the effects of dementia, of an aging brain with, dementia and Alzheimer's. You can make those changes to improve the quality of your life. However, once you go to stage five, it really is not reversible. There's seven stages, and basically the last stage, last 2 years of your life, in stage seven, will be someone changing your diapers. It's not a good scene. And if you have loved ones that you really care about, perhaps you would like to do something about it now. Okay? Don't wait to quit smoking when you get the diagnosis of lung cancer. Well, don't wait to make these changes in your lifestyle now to get you the better chance of having a much more productive brain health, aging brain in the years to come. I'm Dr. Brian McKay, Core Health and Darien. Yeah, I'm a chiropractor, but here's the thing: is there's really no medicine to treat. You're not going to really treat the hyperlipidemia and the hypercholesterolemia with one particular medication. You can take statins to limit the cholesterol, but it's not enough. You have to know you're at risk, and you probably have to make lifestyle changes. And yeah, I'm a chiropractor, but doesn't mean I treat bad, just bad backs. We're about keeping people healthy. I'm Dr. Brian McKay. I hope you learned something today. Thank you very much. Have a great day. Listen again.